All right, well, as we age and rely on our bodies more, we put a bigger emphasis on preserving mobility and optimizing performance. Dr. Berger is pioneering minimally invasive orthopedic techniques for joint care. Earlier, I chatted with tennis pro and patient Joe Perdue and Dr. Berger himself. Take a look. Joe, good to see you.
Thanks, Kara.
All right, tell us your pain story. How was knee pain getting in the way of your game?
Well, it was something that, like any sports injury, we had to manage, not only in running, jumping, changing direction for tennis, but preparing to play. So weightlifting, squats, things like that became very difficult. And as those things become limited, we tend to make the matter worse. And so as time progressed and we tried everything we knew to do to manage the pain, to prolong the life of the knee, eventually we ran out of options, and Dr. Berger became the best of the remaining options.
All right, nice. Well, we're going to ask Dr. Berger a question in just 1 second, but before finding Dr. Berger, what had you tried for your pain management?
Well, I had really good doctors and therapists here in the Atlanta area, and we tried stem cell injections, PRP, cortisone shots, pretty much every option we knew.
All right, well, without further ado, we should get to Dr. Berger. Hello, Dr. Berger. You're a world-renowned orthopedic doctor. Talk to us about working with athletes, and for many of them, knee replacements can be their biggest fear.
Well, thank you for having me, first of all. And yes, I work with a lot of athletes, and having any kind of injury is really terrible and really sets them back a lot. Certainly a knee injury is probably about the worst. We rely on our knee more than any other joint in our body for doing activities such as Joe just said, and running and cutting and stopping and playing tennis. So I see a lot of patients from all kinds of sports that come to see me because they want to get back to a high level, as Joe did with a national championship.
Ah, very exciting. All right, Joe, let's talk about then how your game and your life has improved post-op.
Well, movement's important in most sports, and tennis as well. And so being able to run and jump and recover without pain is pretty fundamental to playing your best. And so if the goal is to reach your full potential, you need your joints to work properly. And as we age, that becomes more challenging. And as a knee replacement being a nice example, it becomes a choice that is, whether you like it or not, if you're going to keep playing, it becomes the only option remaining.
Sure. And then after surgery, how long till you were up and at 'em again, so to speak?
Well, up and at 'em pretty quick. Dr. Berger told me at about 3.5 weeks to do whatever I'd like to do, whatever I felt comfortable doing. And so to me, that meant I was going to push it and see how it felt, and the results were remarkable. I was playing tennis again, 1 month after surgery. I was playing tennis pretty normally, and at about 6 weeks after surgery, won our tournament, won a big tournament.
Oh, wow.
So
congrats. That's got to feel good.
Thank you. It was very nice and somewhat surprising. Yeah.
Right. Feel good on all ends. All right, let's talk about Dr. Berger, his team. What made this such an easy, stress-free experience for you, Joe?
Well, Dr. Berger's process, which I believe the acronym is BEST, that he uses, is certainly a concierge program. And as far as the process for a patient, from the first interview through the surgery when you're actually in Chicago at the hospital, to the flight home and to therapy afterwards, is the best experience I've ever had working with any business of any type.
All right, Dr. Berger, I want to ask you, you're able to perform anything from a knee to a hip replacement, but the key is you keep it minimally invasive. Explain what that is.
With the normal surgery of the hip or knee replacement, the muscles, ligaments, and tendons are cut, and then the joint is replaced. And while the joint works great, it takes a long time with lots of pain and swelling and physical therapy for those muscles, ligaments, and tendons to recover. So what I do is I do it without cutting the muscles, ligaments, and tendons, so that there's less pain, less swelling, a much, much, much quicker recovery, and a much more full recovery. So you can get back to doing the high things like Joe's doing, winning a national championship in tennis.
All right, Dr. Berger, last few questions for you. How can you help any out-of-town patients? Talk to that.
Well, we have this BEST procedure, which stands for the Berger Elective Surgery and Telemedicine. So what we do is we combine telemedicine with surgery. So we will first see a patient on Zoom from their comfort of their own home in whatever city they're in the United States, or in fact, from all over the world. And then we make a diagnosis. We tell the patient what they need. If they need surgery, we can schedule surgery over the computer. They come in. We meet them, we talk to them, then they have surgery either that day or the next day. They spend a day or two in Chicago, and then they fly back home to any city in the United States or anywhere in the world, and then we follow up with them with telemedicine. Now, some patients like a more one-on-one direct contact, and for those patients, we see them as a normal patient preoperatively and postoperatively. The patients who want to do more over the computer from the comfort of their own home, their own city, do that more with telemedicine. So we really make this customized to what the patients want.
All right, excellent, doctor. And somebody who's watching right now, they might be a little scared to make the call. They might be living in pain. What would you tell them?
Don't wait. You know, it's remarkable. Most patients with arthritis are afraid of the pain from surgery, and they're living with pain every day.
Dr. Berger, thank you so much for all of those important answers. And Joe, thank you for being a champion on and off the court. We appreciate having you here and telling your story. Thank you so much, gentlemen.
Thank you for having me.